Imagine giving birth to a beautiful, healthy twins, but being in so much pain afterwards, you can't sit down to feed them. A 34-year-old mother found herself in exactly that situation, unable to sit for more than a few minutes in constant pain near her tailbone and desperate for relief. Doctors told her it was just low back pain, but what if the real problem was overlooked and it wasn't in her back at all? This is the story of how Physio uncovered the real issue and how one woman reclaimed her body, her comfort, and her motherhood. 4 months after delivering twins vaginally, this 34-year-old woman was still in pain. Pain in her buttocks, pain in her sacroiliac joints, and worst of all, pain in her coccyx or tailbone, especially after sitting. Radiographs were clear, medications helped only briefly, a donut pillow was prescribed, but things got worse. So her doctor referred her to Physio, and that's where the real answer began to unfold. The Physio assessment. At her first Physio session, posture spoke volumes. Rounded shoulders, forward head, and all her weight was going straight to the coccyx. Trigger points were found in the key muscles, that is the piriformis, the gluteus maximus, and the levator ani, a deep pelvic floor muscle that is often ignored. An internal exam showed high tone in the pelvic floor, which might sound like strength, but it was actually spasm and pain. Misdiagnosis revealed. The referring physician labeled it as low back pain, but the Physio knew better. This wasn't a spine problem, it was Coccygodynia, pain in the coccyx caused by soft tissue trauma during childbirth. Think about it. The coccyx flexes and extends during delivery. In this case, it was likely bruised, possibly displaced. The donut pillow, it made her worse by pushing weight directly onto the injury. Her treatment plan, instead of treating the spine, the Physio addressed what mattered most: the soft tissue dysfunction. Here's what the plan looked like: soft tissue mobilization in the glutes, trigger point friction massage to the levator ani muscle, biofeedback using rectal electrodes to reduce the pelvic floor tone, postural retraining, teaching her to sit with weight on the sit bones, that is the ischial tuberosities, not her tailbone, replacing the donut pillow with a wedge cushion with the coccyx cutout, a custom home program with stretches, self-massage, and guided partner work. So that is how a treatment plan looked like. So adapting to the reality, here is the reality. She was a new mom with twins, 3 therapy visits per week, not going to happen. So the PT adapted the plan: once weekly in-person sessions and a doable home program 2 to 3 times a week. Her husband was brought in to help. Together they learned partner massage, how to use the biofeedback device, and created a system that fit their real life. Her results and recovery: within 4 weeks of this modified plan, something incredible happened. The pain resolved. She could sit comfortably and feed both babies. Pelvic floor tone was normalized. Her posture was better, though still in progress. She was no longer afraid of her own body. The therapist discharged her with a plan for continued thoracic and cervical posture training and new tools to stay strong. Her clinical breakdown: this wasn't just a case of postpartum pain. It wasn't a case of postpartum pain. This was a classic case of misdiagnosed coccygodynia. The origin was likely trauma to the coccyx during delivery, common but under-discussed. Coccygodynia often masquerades as low back pain or sacroiliac joint pain. That's why precise physical examination matters. What helped most? Releasing spasms in the levator, ani muscles, and piriformis. Biofeedback to normalize the tone. Teaching functional real-world posture. Replacing unhelpful tools like the donut with correct supports. So what can we learn from this? The key takeaways: pelvic floor spasm isn't always about weakness. Sometimes it is about tension. Coccyx pain isn't just part of recovery, it's treatable. Postpartum women deserve better diagnostics and better support. Physio is more than exercise, it's education, adaptation, and healing. If you or someone you love is struggling with postpartum pain, know this: there are answers. You don't have to suffer in silence. Ask questions, seek a PT who understands pelvic health, and if you are a clinician, look beyond the spine. Look at the tissue, the trauma, and the truth behind your patient's pain. Like this story, subscribe for more real-world healing and PT case studies that matter. You can also support the mission by donating through Patreon or PayPal link.